you're heading out today, be prepared to face arrest, fines, and possible prosecution if you're not wearing face mask or violating any of the COVID protocols. That's the warning as the Region Security Council begins enforcement of the protocols. There's been consistent rise in cases since May, leading to the third wave infections. But authorities want to bring the situation under control by compelling people to break the chain of transmission. Let's go live to the Ashanti region, the second hotspot in the country. Nana Ojima is on standby from Kumasi for us to assess the compliance level. Nana Ojima, how are people taking this, if you like, order coming from the security agencies?
So this is Tech Junction, and it's a popular lorry terminal here in Kumasi. As you can see, there are a number of people here awaiting transportation or vehicles to their respective communities or areas or destinations. Now, people are still not really complying with the protocols of COVID-19, as you can see. Even though the security agencies and Regional Security Council are calling on the public to ensure that they wear the mask and also adhere to all COVID-19 protocols, we are yet to see that fully be adhered to by the people. When I came here, I'm yet to see a Veronica bucket or any flowing water, running water, which people can use at least to wash their hands before they get on the bus. That is not present, first. And secondly, you don't see anybody trying to tell them to comply with the protocols. This comes even after the Regional Security Council announced that they will be checking that whoever joins a public transport is wearing the nose mask and adhering to all COVID-19 protocols, and that the punishment is that the driver and the mate will be held liable when the passengers refuse to wear them. And this is something that most of the drivers here do not agree with. They believe the people should carry their own burden. They shouldn't be burdened by the refusal of the general public to adhere to these protocols. So I have some with me here, some of the drivers and station masters with me here to talk to us about why they are not ensuring that their passengers adhere to the COVID-19 safety protocols. I've been here for some minutes now, and I've realized that not all your drivers are wearing the nose mask. Why is this so?
Like I say, the passengers, we drivers, we can't force the passengers to wear the nose mask. Why? Because some of the passengers, you tell him that to wear the nose mask, we fight at you. Or you get out of the car. We also need the passengers to work it. So that you can't force the person to wear the nose mask, because it's not our duty. Our duty is to find the passengers to go wherever you go. But if you say that you want to put that pressure to the passenger to wear the nose mask before you get the car, I don't think it's good for us.
So what do you think should be done? Because now the whole idea behind that, or behind putting the responsibility of this responsibility into your hands, is that it will help ensure that whoever joins a vehicle is well protected and whoever enters these vehicles are safe. But now you want government or the security agencies to take this responsibility. Why?
You want the government to put the possibility to use that different thing to assure the public to wear the nose mask. But for us, our drivers, you know, the commercial drivers, some of them can park over there maybe 20 minutes, 15 minutes, it doesn't get the passenger. But it's a challenge. All of the stations, they are working to find the passengers to go wherever you go. But if you say the drivers are to push the pressure to the passengers to wear their nose mask, I don't think it's good for us. So I have to give the advice to the government to find a way to do that thing.
Okay. Yeah. So in summary, he thinks they are businessmen and their focus is to ensure that they are in business. So sacking or not allowing people to join the vehicle because they are in nose masks shouldn't be their responsibility, and it will affect their business. Let me talk to this driver. I can see him wearing his nose mask. Also, now what to say? can yellow, right? Now, nose mask, no, we have a so be a chance and what to can.
Hey, hey, Asemo, drive for the money, Asemo to your sodia. And yes, and Papa said, my baby have 4 hours, a dream so. It took us on Shen nose mask, no one see for more. Let us a 1 hour lose you, Juma, to say, Franopa, Mako Buako 2 pe. May the work of Fen Mako 2. Missy Kaya say. And here say, Abano Mombua, now security agencies, no said the Omiana Canano, Omobuana, Yetimi, Ayanasa, Omobuama, Nipanati mission, and therefore the Cassia for so passenger Manasha and nose master. It will be a problem to us. A bit wiki business.
So he is saying that he's been here for more than 4 hours trying to get passengers to join his vehicle, but it's because because the people are not coming as they expect. So if he should force people to wear the nose masks, a lot of people refuse to join the vehicle and it will affect his business. So he believes that government and security agencies should rather ensure that this protocol is well adhered to. Let me try and see if I can get into this vehicle, which is almost ready to leave. Let me talk to the conductor here. Mate, na nose mask no dey won be.
Apacho me dey share we come sisi e.
Na dey tin na won share. So obeje so je nipa woni amanfo di nkomo ne ade.
Ene e no kra de e wo ma na ya share wo musa na ase de ato bebi kakra.
Ade tin na wo mu a owi.
Oh sai se ane pe free air e person from afa yan kakra ase share na ho meti. Ba no so nche se yen share be share. So hunu e be share. Nti e wo kai mu e koduka no ma na ya share because of passengers no. I really think to person spread it. Then yeah.
But when himself Oja from cross still say.
Any no crack. Me from cross me share. Sense I learn there about chairman sanity. Okay,
so he accepts that he's supposed to wear the nose mask, but it's difficult wearing it throughout the day. So he thinks that if he should wear it at a point and remove it at a point and continue with his business, it's okay. He can do that and be safe. But he believes that wearing it for the whole time will be better comparatively to wearing it intermittently. So I can see this vehicle ready to leave, but there are a number of people in it who are not wearing the nose masks. Some of them are wearing it beneath their nose and their mouth. So it's a challenge, not full compliance. But to some extent, I can say that compliance to this protocol has really soared. Or, we are seeing a little bit of raise in the people who are wearing the nose masks. Before the Regional Security Council made the announcement, it was very difficult to see people in the Kumasi metropolis wearing the nose masks and going about their normal duties. But to some extent, there is compliance. Let me try to draw closer to these ladies who are trying to, they are in a queue trying to get a vehicle to their destination. Madam, you need to come back. Most also nose mask. What's the action throughout the day? What's the action throughout the day? If you say in the whole day, what say?
Okay, me free and I'm a fashion. The whole day, I'm me free and I'm a fashion.
Say now, feel about compliance generally. Who say ni passe? Say also ebano.
But most people, especially the educators, me for instance, and now a program was so make your nurse penny on so she always educates us on that. In most of us need we put it on when we are leaving the home.
But are you worried that we still have a number of people who are adamant about this?
Yes. Because I still understand that most people do not have an idea that the disease is still in persistence. So some don't take it serious. And it's not the right thing to do.
So it means that you believe that education should also be raised?
Yes, we should have education on that. Much education should be put on it. Yes.
All right, thank you very much. Okay, so let me talk to these conductors. They are still waiting for their turn to load their vehicles. And even though I can see a few of them wearing their nose masks, others are not. Let me talk to this gentleman. I mean, Musa say, at the country I want to share the nose mask. I didn't tell nose mask on show there.
My share me gonna cry me. Yeah, na me homia
When what do you know?
I told me care cry.
Okay. I was say time be I say so that wait me about home.
I was time be I me say bet. Musa na told me be I say. No able. Na I say me homia me wo ya lebi o say me homia na yeah happy.
So this gentleman here is telling me that he's been wearing his nose mask, but at the moment he's tired. That's why he doesn't have it on. So I wanted him to show me the mask, but he is telling me that he left it in his vehicle. I don't know how true that is. Let me sit in their midst and get to talk to some of them. Hey, what they want your nose mask? Why you want? Let me send any income. What you send the whole day?
I'm not mentioning the whole day.
It means I say I'm pastor say yeah.
Every blessed day be a machine nose mask.
They be also nose mask.
They be also.
Now what it answer?
Me manage somebody say na me didn't see.
But what ni pe go abebre na won say a hard drink so won say there.
You know cross are I won say adwuma na na you see somebody dey wait no. You see me sound so dey ase.
This gentleman's excuse is that he just finished eating, so he's waiting for some time before he puts it back. But the man on my left, it's saying that since morning he's been wearing his nose mask, and this is what he does every day on a daily basis. And the gentleman on my right is saying that that's true. He's confirming what his colleague here is saying. So let me talk to the other ones, the other guys here. And most of them are not wearing the nose mask. You know. Okay. Yeah, catch you, me and Kasa. Now, what international nose mask?
Oh, about your there be never be I say. Yeah, to come with the I by a bedroom station. I said, I'm at a station there. Oh, yet as I am not yet sharing humanity. So, I home it's here near didn't know. I am near Ika said a you be free air.
Now you say COVID no to say crowd to me be. As in say na only person be still everything how.
Okay, yeah dey nim say had the pete mu dey. Nim send dey emfa how bi ama.
Ha pete mba mo te am donso.
Okay. But you know say dey free mba bi amehye.
So this gentleman is telling me that whenever he enters his vehicle, he does well to wear the nose mask, but immediately he leaves the vehicle, the nose mask is also on break. And I advised him that no matter where you are, if you are in a populated environment, there's possibility that you can contract the COVID. So he should wear it, and he agreed. So let's go through Tech Junction. Let's get to different parts of the area and see how people are adhering to the protocol. A number of people are wearing it. I can count some, but there are still a huge number who have refused to wear the mask. Sir, not international nose mask.
No, I had my basantina. Okasa eno so ehye na okasa obi ante so they are saying na mami yen bibianti
na uji dis COVID na ho
madam de maso na ate ba me de me hu bi de maso na ate say ya le bia baba me hu bi
enti uji dis say no
ya le de say e kase ya le abade a anyone man komunka
enti o ya mpanyufo sa o campaign for na station ha no hu bi na dey na mo ye e dey aboa mani pa hye nose mask especially o join mu vehicles no
one thing is nose mask no dodo na hye ebi nso hye e na nipa no so ba na aka so hye nose mask a o dey abufu anra aka so be ka kire no wani nye wo nti adaruma obi wo no ba o ma nka sa nkire no obi wo be ba na di hye no
By idea high and says and Cabebois said you bet me to Asia, no smas and any boy. Adama, a bicra and combe, some bet me to be a brew or ha, nego, only a crobano in Shebia. Oh, Konako Iba, Kona, the Ablens, so my man Pachoji, and now Brown Pachoji, no smas, and Visa and Cabebois.
So he maintains that they are in business here as truck drivers and conductors. So it will be very difficult for them to sack their passengers who are not in the mask, and it will affect their businesses. So if government would want them to enforce this, at least government should provide nose masks, them with nose masks. Whoever comes and is not in a nose mask, they give the person one, rather than sacking the person from or preventing the person from joining the vehicle to their various destinations. Let me speak to, finally speak to this gentleman. But now we are doing nose masks and saying now, nation is it here Tech Junction area?
You know, smarts and share what take junction at the air form. Because me, I may make us a station master. You know, smarts and share air form. Yes, to say, yimping for that station. I don't know. Yes, I've been says, I need to tear you best passing your phone. I'm a no smarts or mush because Tama, you're by a giddy, no. A buying a back side, you say, sanity, I was here, see a bois. Until about say, Uni no smarts. You're my own fro cano. You say what to be now, they are from. I say, Aban say, Nimuka craning tino. I say, no smart in a minimum Ukrainian Tech Junction and Cassadia. It was from your Tech Junction, even cry one namoa, another than to crown. It was from cry, from Tisaban bit me a share, get to say the first no, they buy an police for them, crooning no smarts in the idea, if you think no ever boy, because he been tis a arena cry, a binti by a reno or this old home by Miss Mebom home by a say arena so better.
Thank you very much. So he believes that the nose mask should be worn, but he had his own drawn to his chin. And when I asked him, he told me that he was taking in some snack, and that is why he didn't have his nose mask on. But he believes that they, as station masters and leadership of this area, should ensure that the passengers and other people who use their services are wearing the nose masks. So far, even though there is some enforcement in the Kumasi metropolis, it's very difficult to have more than 40% on of the people on the streets wearing the nose masks. At Tech Junction, I'm here to cite a Veronica bucket to ensure that whoever comes in is get the opportunity to wash his or her hands under running water with soap.
Interesting, and listening to people's perception about wearing of the nose mask and the different reasons they're giving for not wearing their mask. But of course, you made the point that you've not cited any security personnel enforcing the order over there. And of course, in your video, we've not cited any policeman, any security personnel around trying to enforce that people wear their nose mask. But for the past 2 weeks since the announcement, what has it been like? Has there been police personnel deployed to ensure that there is enforcement of this order?
So somewhere last week, we had the Regional Security Council coming out to announce that various intersections and on the road we have number of security agencies or services on the road to ensure that this protocol is well adhered to. I did some check in the Central Business District, and earlier this week we have some security personnel, especially task force from the Kumasi Metropolitan Assembly at the KJTR market, ensuring that whoever enters the market is with a nose mask. But aside this area, I'm yet to cite any of these security agencies on the street, ensuring that there is adherence to this protocol. But after the announcement, I've seen that the level of compliance gradually is rising.
Is our man monitoring for us in Kumasi whether people are enforcing the order. for people to mask up and also obey the COVID protocols. We'll have the concerns raised, we'll have answers to all of that when Dr. Kuma Abuaje da Costa, who is with the Ghana Health Service, joins us later on Zoom. But back here in the national capital, head of our health desk, Fred Smith, has more in the following report, looking at why it has become necessary for the Regional Security Council to roll out enforcement measures.
Main hotspot of the virus in all the 3 waves suffered by the country. As the gateway to Ghana, the first cases came in through the Kotoka International Airport in Accra and then spread through communities here before hitting other parts of the country. The situation has been compounded by people's refusal to wear the face mask, observe social distancing or avoid crowded places. Officials who've been criticized for failing to enforce the protocols are now responding, promising to deal with recalcitrant residents. The Security Council, the Public Health Emergency Management Committee, the Police Command and the Health Directorate in the Greater Accra region are teaming up to deploy police and other officers to conduct routine checks at public places, including schools, markets, shops, lorry stations, and especially in public transport to ensure there's strict compliance. Owners of shops and operators of public places who fail to provide the required logistics to aid the compliance will face sanctions under the new directives coming into force today.
It looks like the only way to get people to comply is to ensure that it is enforced. And so as a result of that, the regional minister has asked all the MMDAs in all the 29 districts of Greater Accra region to ensure that they empower their security agencies to enable them, arrest people who don't comply with the directive. But we are also on our part enhancing or intensifying risk communication activity.
And that was Dr. Charity Sapong there. Now, heads of the 29 municipal and district assemblies, together with their divisional commanders, have been tasked to conduct inspections at beaches, markets, and even churches to ensure the strict compliance of COVID-19 protocols. The move, according to the Greater Accra Regional Minister Henry Korte, is aimed at containing the spread of the pandemic in the region. Mr. Korte is speaking to JoyNews, observed that the security personnel will not hesitate to arrest and prosecute persons in breach of the protocols.
We are aware that there's a third variance, and we only have to activate the existing protocols. Now, we have directed that the security and intelligence agencies begin to enforce or to ensure strict compliance of these COVID safety protocols. Is it going to be a wholesale thing or is targeted, first of all? Well, if you recall, the last time we did it, all the assemblies were tasked to hold, if you and these bodies represent the security structure of the local governance at the district, and once they do that, they educate the people, they bring the awareness, they sensitize the place, and they ensure that enforcements are done. So all we are saying is that what we did some months ago, that the beaches and all that were closed, we want to revisit that. Mr. President has given clear directives as to how things should go. Open area, strict compliance to the safety protocols, i.e. and all that. And that is all we are saying. We are not reinventing the wheel.
So we see the policemen on the streets.
We see the security and intelligence agencies working together with the assemblies.
I see, but I want to understand this. The conversation about those who are in breach of the protocol, what then will happen to them when your people meet them?
Every act law in this world has areas of penalties. And we all know the penalties when one breaches the COVID safety protocols. That will be applied. And indeed, it should be in conformity or guided by what the law prescribes when there's an offense. But as much as possible, the assemblies have been encouraged to try and educate the people more than using the brute force. Yeah.
So when we see any form of arrest going for a lot of education from the assembly.
I am not saying that we will not see any form of arrest. We are saying that it is a combination of how to ensure compliance and intervention.
Henry Koche is Greater Accra Regional Minister. Let's have a conversation on the enforcement at the various levels. And on Zoom for the conversation is Dr. Boaje Da Costa, his team leader, Risk Communication Subcommittee, COVID-19 Task Force at the Ghana Health Service. I'm grateful, Dr. Da Costa, for your time. What's the rollout plan?
Thank you, Aisha. I think, listening to the various stakeholders that you've spoken to, your correspondent First Mate and the regional minister, you can certainly see that some actions are now being taken. We from the Ghana Health Service have actually engaged extensively, and we believe that the regional security councils across the country with the public health emergency system, the district public health emergency systems should obviously take the enforcement to the next level in their various regions. Certainly that we do have some emerging hotspots like Bono, Volta region, and the Bono East. So last week I heard on your set interviewing the Bono East Regional Regional Director of Health Services. He outlined the measures that obviously that region have actually put in place with the Regional Security Council. Now, Honorable Henry Kote also yesterday released a statement based on the engagement that we have had with them on how they are going to enforce this within the Greater Accra region. Other regions are also doing the same. We continue to engage to make sure that we get full compliance. Like I told you last 2 weeks, for behavior change, we are looking at 3 levels. We from the Ghana Health Service will give the awareness and the education and sensitization with our colleagues from NCC and Ministry of Information. Now, the second level is the responsibility bit, which we have come up with a strategy as well, which is the peer-to-peer responsibility strategy. So, for example, if you see that your colleague is not wearing the face mask, you tell him or her, please wear your face mask, or you don't talk to him or her. So you also take the opportunity to enforce it at your surrounding or your setting. So that's the next step. So being individual or collective, let us enforce that at the second tier. Then the third tier is where we have the regional coordinating councils and the assemblies and the security services supporting us in achieving, obviously, total compliance. So these are the measures that we put in place to make sure that everyone do comply with the safety protocols. And I believe that it started picking up and it will work. If we give ourselves some few weeks, when everyone is complying, I'm sure that the infections will keep coming. It will start to come down. Let's bear in mind that this is for both the vaccinated population and the non-vaccinated population. So because you are vaccinated, it's not to say that you shouldn't comply with the safety protocols. Please comply with the safety protocols even after vaccination. The government on its part is doing everything possible to get the vaccines in for people to be vaccinated. As you watch, within the week, we've taken delivery of about 177,600 Johnson & Johnson to support our vaccination exercise. And it is truly by the effort of the government. So I think in all areas, you can see that we are trying our best to make sure that we obviously protect the population and achieve our goals as we have set for life to return to normal.
Dr. Da Costa, our checks in Kumasi, for instance, at the terminals showed that there were no police officers there to enforce the rules. People blatantly disregard the wearing of the mask and the observing the protocols. Drivers who themselves are culprits say they cannot tell their passengers to wear the mask. Why is that? I know you are working in collaboration with the police to ensure this happens. When are we going to see police visibility? And there's also no Veronica buckets at the terminals, for instance, for passengers to get opportunity to at least wash their hands before embarking on their journey.
Okay, so thank you very much. I think we should look at it from the GPRTU's obviously setting. So what we've been doing within the last few weeks is to engage the various GPRTUs as we did initially, and also to make sure that their leaders actually take responsibility in enforcing obviously the protocols. It will come on. We've just started engaging the regional ministers. So I'm sure that within the next few weeks it's picking up. I heard from your reporter that it is gradually picking up and it will pick up. Now, let me take the opportunity to also send a strong signal to the GPRTU, the drivers and their mates that they are responsible for the safety of the passengers, and therefore they should not carry anyone without a face mask. And they themselves should also comply with the protocols. They are responsible to providing the hand washing facilities at their various terminals to make sure that passengers do comply, wash their hands with soap and running water. They are responsible to provide all those things within their areas. So I'll plead with them to do that. But I can assure you that our engagement with the police, the Regional Security Council, the regional ministers are actually going on very well. And I'm sure that they will be enforcing this. It will gradually pick up.
When are we going to see the police going round and ensuring that people wear this? Because at one of the terminals, one driver who's supposed to be helping ensure that people observe the protocol says he's been in the queue for too long, so he cannot waste his time asking people to observe protocols. That is not his duty.
Okay, so I think the responsibility has also been given to the assemblies. So we will have the assemblies task force going around. And I've seen some, like I'm saying, we've started an intense conversation with them. So actions are now being taken. So just give us some few days, few weeks, you'll see that all these things will be in place, like we started initially. I must say that's why I said that we also have a second tier, which is the peer-to-peer enforcement strategy. So the drivers, the mates, their leaders do have a responsibility. It's not only the police and the assemblies task force, they also have a responsibility. And we've engaged them. I mean, we've organized a series of interactions and training, capacity building for their leaders and some of the drivers as well. So through the Ministry of Transport, through Honorable Esiama, we've engaged almost all the associations within the, that space, like the GPRTU, the Pro-Tour or something, I don't know how we call them. We've engaged a couple of them to let them know their responsibilities. So I'm sure that they should really take it to their own, they should really enforce it. And I'm sure that further engagements will really help settle the dust.
How about stuff like the Veronica bucket that should aid people wash their hands at public places? How are you working on that one?
Okay, so all along we've been working with the local authorities. You see, so if you've checked our strategy very well, it's the local authorities that do provide those things to the various places. So, like I'm saying, we have just started the conversation for them to obviously go back to the basis for us to get to where we are, because the numbers keeps going up and we cannot continue to just sit down and just wait. So we are engaging to make sure that they also play their part. Like as for the COVID task force, it is multidisciplinary. So we have various agencies in there playing various roles and other things. And that is the strategy that we've been using. And I think, like I have said, things will continue to shape up. So let's all have play our parts. And I'm happy that the media is also interviewing me, but the media should also take it upon themselves to step up their parts in terms of the education and other things, and so that we collectively as a country achieve what we want to achieve.
So let's look at our situation as a country. Where are we now with our COVID-19 figures?
I think, in fact, let me be honest, I haven't checked this morning, but the last time I checked, I think it was around 6,000, 7,000 thereabouts. So I've been very busy. Okay, so as I can see, there's about 6,900, and the new cases as it is on there is about 409. So yes. We've crossed the 100,000 mark. So to me, I think all we have to do is how do we bring these cases down? How do we reduce hospitalization? How do we make sure that the population are vaccinated with the few that we've had? How do we make sure that we actually enforce the protocols in such a way that every Ghanaian is complying to the directive? So those are the critical questions that I have to, me and my team are battling with. So obviously our aim is to make sure that we get 0 active cases. So let's all play our part to get that.
I'm happy that you talked about the Johnson & Johnson vaccines that are here to help us vaccinate quite a number of the people. When are we going to begin the rollout?
Currently, you can see that we are planning very soon. The Director General or the Minister, the task force will come out with a comprehensive plan as we have been doing. But serious planning is ongoing, including capacity building and other things. For health, we don't take things for granted. So now that we have actually receive this in country, we have to do obviously orientation for the vaccination team and other things that will be happening within this week, and I'm sure that very soon we'll roll it out. But we'll bring on board the details. The Director General will really take it. We'll announce this very soon for everyone to know where we are doing it, the centers, and our strategy for deploying these vaccines. Everything will come out very soon.
Dr. Da Costa, I say it's a double jeopardy for us in West Africa because we're told that there's also a deadly virus that has been detected, according to the WHO, which is in the family of the Ebola virus, the Marburg virus disease. Any alert from the Ghana Health Service yet?
Not at the minute, but we have, we've heard it. We also have that surveillance system that is able to obviously pick up some of this intelligence. So certainly, we will be coming out appropriately. Normally we assess the situation, then we meet as a group or as management, then the Director General and the ministry issues the alert. So certainly, we pick that up, and bear in mind, we work with our partners very well. The WHO, we work with them. We have their country office. We just had a meeting at the Emergency Operations Center where all the partners were on. So certainly, we will update the country as well on that.
I'm grateful for your time. Dr. Da Costa is with the Ghana Health Service. He's Director of Health Promotions at the service.